Okay, so I'm making this video to go over the immunosuppressant stuff. I ended up starting that medication yesterday, going over the side effects, going over where we're at scientifically with like these type of treatments. Um, just my opinions on like moving forward and with everything that I have going on. So like I've discussed that I have ankylosing spondylitis, an autoimmune disorder that I was diagnosed with at the beginning of the year, right? Um, this is something that I've struggled with my entire life, with like going to hang out with friends and them being like, "Oh, well, you're making stuff up that you just don't want to hang out because you're saying you have headaches, or you're saying that like whatever." And it's like, no, I actually have like a lot going on. I remember watching The Crypt Keeper with my parents when I was 4 years old and being like, "Ah, my joints and whatever." Like I've always had like this extra layer of whatever. And I've had everyone in my life, literally everyone in my life, call me a lost cause or give up on me, stop talking to me after a certain point, because I've been dealing with a battle that they have no idea of, like what I'm even going through, because I didn't even know what I was going through, right? And it may have even been part of like what led me into starting hormones. I mean, just the want to change what I've been dealing with, and like the depression and the just I knew when I was drinking and stuff in my early 20s, it's like this isn't the way. This isn't going to be the way for me. And like I just needed a total rework of my life. And I found happiness with a lot of it, but at the same time I still dealt with a lot of things, and like maybe I wouldn't have transitioned if I didn't have this. So I don't know. Truly, like but like, and at the same time, leave me alone for transitioning. Like again, it's not your battle, and if you don't get it, you don't get it, cool. But like I put a lot of work in myself. So yeah, anyway, this immunosuppressant, it's been terrifying to want to take because like I have surgery in 97 days, finally getting FFS. We have this government shutdown. I may not even have the funding for it. I may lose my food funding next month because of this government shutdown thing, right? So I started the immunosuppressant yesterday, and I've put it off for so long because of the surgery. It was right around the corner this whole time. I knew it takes time for it to like take effect. I was worried about the negative side effects, but at the same time, I'm like, well, not gonna know until I try it, right? But we're gonna go over a list of like the negative side effects of what, you know, obviously immunosuppression, like 3 times more likely to get sick with like colds, flus, fungal infections, hepatitis B infections, nervous system problems like multiple sclerosis, seizures, inflammation of the nerves and eyes, um, numbness or tingling in any part of your body, vision changes, weakness in your arms and legs, and dizziness, blood problems like fever, bruising or bleeding, very easy, or looking pale, new or worsening heart failure, which is just awesome. It's just awesome. When you want to start a medication that's one of the side effects, it's like alternatively, it's like my back being binded when I'm 35, or like being wheelchair bound by the time I'm 40. From reviews that I see online of people with the same symptoms that things that I'm going through, kind of thing. Psoriasis, allergic reactions, lupus-like syndrome, autoimmune hepatitis, injection site reactions, upper respiratory infections, and headaches. So, yeah, I'll just go over like what my side effects are, because like the pain of this has just been getting to be too unbearable to like want to even continue to like deal with this anymore. Like I'm just like, I have tried every remedy that I can kind of think of. I'm not smoking because I have the surgery coming up. Like, not cigarettes. I don't like cigarettes. Like, I'm over cigarettes, well over past that, right? And it's not like I'm the only person in the world that's struggling with this condition. There's so many people that probably have this that they don't know. And this is a condition that comes out in male-born patients, right? That it's just like, it's kind of funny that like I transitioned and I felt like I needed to get away from like my old self kind of thing, and how unhappy I was with it and everything, just to find out at the beginning of this year that it's like for male born patients to get this type of HLA-B27 positive marker kind of thing. So I did the injection, and immediately I had a headache and nausea. I'm like, I'm gonna puke. Oh wait, I'm not gonna puke. I'm gonna puke. I'm not gonna. And this headache was just like, okay, this is weird. I kind of had that in going into the night kind of thing. I was having pain in my chest and my left arm for over 2 hours. Just chest pain and pain in my left arm. Normal stuff. Numbness in my right hand. Which has not gone away since I can move my hand, but it feels like, it feels like partially numb, and, isn't this worth it? Numb right hand has not gone away since injection, and then difficulty falling asleep, waking up with difficulty breathing. I guess I kind of slightly have that a little bit still. And just my skin being extremely pale, because now my skin's like super pale since I did the injection. So yeah, trade-offs, are they worth it? Are they not? I don't think so. I read that the side effects are typically more extreme the first month of taking this medication. As far as my rheumatologist said, it's going to be at least 6 to 8 weeks before I really notice a significant improvement with the pains that I'm going through and stuff. And it's just terrifying. It's this stuff's terrifying. It's knowing that new or worsening heart failure and having chest pains and this kind of shortness of breath stuff. It's should I continue this medication? I don't know. But at the same time, there was what is it? I had this already read remember. Okay, so the Nobel Prize in psychology and medicine. Recently they've been able to isolate the autoimmune responses of stuff that's attacking your body kind of thing, and able to diagnose and treat these rather than nuking your entire immune system, because now I'm at risk for infection. I'm at risk for right? I have to go work a customer service job making $6 an hour because I get to keep half of it because I'm on Social Security income, because I haven't been able to actually take care of myself because I've lived with this condition and I'm being treated like somebody that says, I have depression, I just want to milk the government or something. That's how I feel I've been living my life, rather than actually being able to put my energy into something else and bigger and make something happen, right? And it's kind of sad and pathetic, because I was number 4 in the world on Xbox 360 and gamer score. I was completing multi-thousand-hour games, getting all the achievements. I had an 86% completion percentage by the time I kind of gave up on it. I was beating Japanese games that were all completely in Japanese, Chinese, whatever. I was beating these games with all the achievements as the first person ever after. It's so it hurts to come from a place of intelligence and creativity, I guess, in a way that has never been seen or exercised outside of my little bubble kind of thing. And I've always known that I always felt I'm destined for more kind of thing. I felt I have enough cognitance. I don't know if that's a word. Just a lot going on up here that I was able to, if I was able to just put it into something else, it could be very fruitful kind of thing. But at the same time now, I feel I'm some 80-year-old that has they've lived their whole life, and they're just okay, if I have to take the medication, I'll take the medication. But I'm still just trying to live my life. It's not even I haven't even started to be able to just live my life as how it feels. So it's been really hard, and I want to cry, but I'm not going to cry. And yeah, and even this surgery consult, I'm being denied with that going on, moving forward with that even after being approved for surgery codes and everything, I'm still being denied financial clearance for this last final follow-up with the surgeon to go over other stuff with the surgery that because they just wanted to go over a couple things with me. It's been torture on torture on torture on torture on torture to live my life. And even somehow, some way, I find little windows that I can enjoy out of this. And if I can do it, you can do it. If something is worth enduring, endure it. That's been my Facebook, header thing for like 10 years now. And it's just gotten more powerful. The longer I leave it there, it's just like this. It's so accurate. I mean, but yeah, it's just like I'm at the point now where it's like, do I want to inject myself with a medication that could potentially increase my risk of cancer? Or do I want to hold off and wait for these scientists to find a way to isolate the specific ankylosing spondylitis condition and be able to turn that part off without interfering with the rest of my immune system? What else is going to happen? Am I going to start gaining weight? Is my cognitive ability going to change? I just feel that given the medication, given how I feel now, I have the most mild of alleviation for 400% more troubling kind of side effects. And so moving forward with it, I feel a little bit terrified to continue this medication. But I feel again, I don't have much of an option. I feel like I kind of have to. Because I just know that my back's getting so bad. It's at the point we knew at the beginning of the year that I had fluid of unknown origin in my lower lumbar, and my rheumatologist was typically whenever we have people on this type of medication, this will just be absorbed. You don't have to worry about it. Alternatively, they could do spinal taps. I mean, if it gets too bad, right? So I'm dealing with constant grinding in my hips and back, literally every single night, popping my back 100 times, really loud pops, terrifying pops. It sounds like I ripped my back apart pops, kind of pops, right? It's not human, in a way that you would recognize. I'm living some strange alternative reality that is also here, and it's just wild to me to see that yeah, I mean, I just don't know what the best way to be able to move forward with any of this is, because I've dealt with so much with this already. I feel I've lost so much time already in a way. I just want to be able to live my life, and I want to be able to know that hey, if I get through this part of my life, that there's going to be some something worth it on the other side of this, because it has been torture to the degree of I used to enjoy sitting and playing computer games here and there, just casually. After the 360 days, I haven't been able to sit up at my desk and play anything because of how bad my back is. I haven't been able to sit and play anything for a duration of more than 15, 20 minutes. There's a reason why these videos aren't very long. And whenever I do, I'm in terrible back pain, and I have to do yoga to try to alleviate that. But at the same time, I always hurt myself when I get into these big pops and it's not it's not the way. So yeah, I need to be able to alleviate this inflammation, and in a way that is, gonna actually help. So I feel I do need to take the immunosuppressant for now. I really hope there's some more scientific breakthroughs. Given how the world's going, it doesn't feel like it's going to go that way. At the same time, I just have to live in a bubble of these hurtful, hateful people that want to just run me down for existing as a trans individual. And sorry I don't look a certain way for some of you. Sorry I don't dress a certain way for you. I mean, I'm dressing and acting in ways that make it functioning impossible for me to get through my days, right? I don't wear jeans anymore. I don't wear any tighter pants because of how much discomfort I have in my hips. I have a malformed hip to some degree that my my right side's like a bit more prominent, bigger, shows in the x-rays kind of thing. So I'm like balancing that. I was smashed into a telephone pole how many years ago that like that furthered this upper arm area, just like, and that's probably why this hand is numb compared to this one. It's not numb at all, but like this is just like, so that's where I'm at with like my side effects with this right now. um yeah, I hope that there's like some sort of breakthrough and soon with this stuff. I hope I just wish I could live my life without worrying every single day. Hey, am I gonna get my passport back? Hey, am I gonna get my, oh, there's like a new thing now, telehealths are down. I can't even talk to my therapist like to talk about like the slurs that my parents call me every day and tell me that I'm lazy and I'm 33 and I need to go get a job already. It's like every time I go get a job I hurt myself, and every time I try to apply for a job, like I'm going in like not even able to breathe because of how wound up and like crazy these people get with me and like screaming at me and calling me like names and stuff, and like, but I'm stuck in this situation to stay here to have enough money to actually try to get by. So this is like what I have to deal with. I have to live in a hell and a hell and a hell and a hell. That's what I've been dealing with. And if I can do it, you can do it. You know, that's like, so like, you know, I find windows of happiness in my life, even though I'm dealing with like what I feel is like an insurmountable weight. I am being crushed. My body is crushing itself, is how I describe this. It feels like there's like a 2-ton rebar on my leg sometimes. So I need to be able to get over this stuff before I can even recover from surgery, is how I feel like. At least find some alleviation with it by taking this medication. If I get cancer in the future, I get cancer in the future. I mean, what else? You know, what are my other options? Like I'm kind of exhausted with it. And like normally I would be doing like medical for inflammation, but with the surgery coming up, I mean, who knows? There 97 days, right? Hopefully everything goes smoothly. If it doesn't, I don't know how I'm going to be able to live anymore. Quite honestly, I feel like that's going to cost me my life. Is how it's literally going to cost me my life, and it's not going to be me being like a certain negative mindset or what. It's going to cost me my life given how the world is shaping and how I need to be able to get by. Otherwise, I'm just going to like, it's going to sink me into a severe depression that I don't think I'm going to be able to get out of, because that's the only little glimmer of light at the end of this. And I've fought so freaking hard for this. And if I could have worked a normal job and just whatever, and even just like not even worked my job, like that's how people work anymore. They don't do their jobs, right? I could have been doing that. I could have been doing any variation of that. I could have actually been doing my job too. I mean, if I had this diagnosed and treated properly. So I'm hoping that there's further breakthroughs that actually make this, you know, make sense. I'm hoping that I find the peace that I need moving forward with life, and I start having some like amazing years, because I feel like all the hells that I've gone through, if I can start getting away from these one after another, there would be no greater peace for me, right? Yeah, I just, you know, I wish people could leave trans people alone with like, again, this is unpopular politics with the attacks on trans people, but like it's becoming more prominent day after day, the more energy they put into it. So, yeah, I just want my peace. I want to find my happiness. I want to get a partner someday again. I mean, it's been 12 years or 10 years or something like that, you know? I want to be able to like actually take care of myself and get through my days without relying on other people that are calling me slurs and being allowed to have more than $2,000 in a month. And even if I got a grant to get housing, I wouldn't be allowed to use it to get out of this situation. That's where I'm at, because I'm disabled with a condition that people don't understand. Hopefully, you know, yeah, hopefully there's some breakthroughs here. That's about all I have to say for this one. I know it's a little bit longer, but hey, yeah. Again, if I can do it, you can do it.